everybody. So today we're going to be talking about Oracix, which is a topical gel anesthetic, okay? So it is not a locally applied anesthetic as you know it, with the needle going into the tissue. So we're not anesthetizing the main nerve, the main trunk of a nerve. We are basically anesthetizing just an area around the tooth, which is the root area and then the epithelial tissue around the tooth. So basically, we use this anesthetic with selected patients, not with all of our perio patients, but with patients that may not have a severe type of periodontitis. Go ahead, you guys can sit down. With deep pocketing. You know, it's ideal for patients that have localized periodontitis that, you know, are not very pain sensitive. You know, I kind of passed around the articles yesterday, I think, right? Yeah. We didn't talk about it yet, but I just wanted to mention the two studies that I've passed around. They have both done a placebo-type study with the Oracix gel and have found that the application of the gel reduces the pain when administered to patients who were undergoing non-surgical periodontal therapy. So, you know, the pain was reduced, and so it varies with every patient, okay? You know, so, you know, your instructor when you're in clinic working on your periodontal patients will tell you if she feels that Oracix will be appropriate for the patient. So she's going to help you with patient selection, okay? In front of you, you have trays. We only have, unfortunately, 3 applicators, but I thought you could work in groups so everybody can kind of look at this and try and assemble the Oracix applicator and disassemble it. So first I want to talk a little bit about the product itself. We're going to talk about the properties of the gel. I'm going to play a video for you, which was done about, I believe, 2 years ago, 3 years ago, when the Oracix came out. It might have been a little bit longer. So let me try this and see if the video will be playing. There we go.
I'm Sharon Hayes. I'm the clinical educator with Quite Professional and I'm part of the Western region, and we're going to talk about Oracix today. We've had excellent customer feedback. This is sort of a novel product in the fact that it is a non-injectable amide local anesthetic. This product is the only one out there that's a non-injectable anesthetic that's approved by the FDA to provide anesthetic for the surfaces of the root during scaling and reclaiming. A lot of clinicians might not realize that this is FDA approved. It is going to provide a anesthetic deeper in the periodontal pocket along the root surface as well as soft tissue, and it gives us a onset of about 30 seconds and then about a 20-minute duration.
Okay, so like she said, it's an amide-based topical anesthetic. That means that if you have patients that are allergic to any amides or ingredients in Oracix, obviously you're not going to use this product on them. So it's very important when you are, you know, assessing your patient when they come in for the treatment, and if you are considering Oracix, you definitely want to pay attention to your health history. Okay, so health history is a first. We always do, you know, that first. And every time patient comes in, you have to assess the patient's vital signs, so blood pressure, pulse, respiration, and then always review the health history because things may have changed between last time that the patient was there and now. So, you know, even if they weren't allergic to something, you know, 3 months ago, they may not be allergic. So always make sure that you double check that. So, you know, being allergic or not being able to tolerate some of the ingredients in Oracix, that's one of the contraindications. The active ingredients in Oracix are pilocaine and lidocaine. It's 2.5% of each. And what the product does is basically it blocks the nerve impulses to the brain. So it blocks the pain perception to the brain. And it works locally, like she said in the video, around a specific tooth or number of teeth that you're going to, you know, administer the Oracix to. Again, we are not blocking a nerve chunk. If you remember from AMP, right? We know there's a, you know, maxillary nerve that's divided into 3 branches going to specific teeth. You know, when you have Dr. Kornblum later on in the program, he will teach you extensively about local anesthetic that's using a needle and, a potent injectable anesthetic that we deliver right to the trunk of the nerve. So it really, that really gives us profound anesthesia. Like I said, even the studies have shown that not everybody handles the OraKicks well. Most of the patients that have participated in the study have done well, but there were some, about 5% of the patients, that needed reapplication. That means that they did not get any anesthetic with OraKicks, and they needed to have that OraKicks reapplied, and a portion of them never got anesthetized. So there's a place for OraKicks. It's definitely a great product, and I myself have used it a lot, so we're lucky to have that in the clinic. So moving on, we're going to talk about the mode of action. I kind of started on explaining the mode of action as far as blockage of the nerve impulses to the brain. So we're blocking the pain from getting to the brain. Now the delivery is, you're going to be working with the applicator, and the delivery is done by blunt applicator tip, so it's not a needle, okay? So when you talk to your patients who are going to ask you about this, well, what is it? You're going to recommend it and say maybe you should go with the OraKicks. They're going to say, what is it? And you'll say, well, it's a topical gel that we use. We use an applicator and a blunt tip applicator to deliver the gel to your gum around the tooth and then into the pocket. And it helps anesthetize that area so we can go in and perform our deep cleaning. Usually we use this for patients who need non-surgical periodontal therapy. Are there other patients that may benefit from it? Yes, there are some patients that have just sensitivity in general when you get on their teeth with your instruments. And I know you guys haven't done a lot of instrumentation yet. Has anybody done any instrumentation? You have? Good, good. So, you'll do more instrumentation, so you may see more uses for this. Has anybody ever had local anesthetic? Yes? So what would you say was the most difficult part of the procedure for local anesthetic?
For who?
For you. Like when you had it done, was it painful? I mean, would you mind having it done again, or it's something that you prefer not to have done?
I would prefer not to have it.
And
It doesn't really hurt that really, but I think it's more the thought and
I hear the afterwards,
Yeah.
and the numbing sensation. What else?
Oh, I was just gonna say that, yeah, it didn't hurt. My babe did it just to get her requirements. She's like, do you mind? And I was like, no, go ahead. But yeah,
Okay.
afterwards,
Yes.
it's just annoying more than anything.
And that's one of the reasons why OraKicks is liked so much, why it was so welcomed into our repertoire of pain control management tools. Can you check for me to make sure it's recording? Is it counting?
Yeah,
Good,
it
thank
is.
you. Okay, so let's move on. Okay, we're going to talk a little bit about the application itself, and you will try this on the type down. But basically, when you decide to use OraKicks, you want to have your armamentarium ready, and we'll cover that in a little bit. But when you are actually going to administer it, you want to make sure that you only apply a very thin ribbon of the gel. The way this works is it starts in a liquid form. The OraKick starts in a liquid form. And if you take out the cartilage, you open that little package with the cartilage and the applicator, and you hold the cartilage up, you can see a bubble in the cartilage. And if you kind of move the cartilage to the side, you can tell whether it's a liquid form or if it's a gel, right? It should be liquid form, so the bubbles should be moving very freely inside the cartilage. So that's one thing you guys want to check before you assemble OraKicks. You want to make sure that we have a liquid state. I need to tell you that if you expose the cartilage to any kind of warm environment, like some dental offices have heaters for cartilages, for anesthetic cartilages to make it more comfortable for the patient. You do not want the OraKicks in that, because if you heat up the liquid, it's going to turn into gel. And when it turns into gel, you cannot inject it. So you cannot use it. You cannot, it won't flow through the applicator. So that's one thing that you want to make sure that you guys check for before you start doing anything at all, okay? When we actually administer the gel, we first lay a little bit of the gel around the marginal gingiva, around the tooth, and going a little into proximally. We're on the surface of the gingiva, you guys, okay? And we're gonna choose about 3 teeth at a time that we're gonna do. We're not gonna do the entire mouth. Now, important, and we will walk through this again with, our practical application, but you really want to keep the teeth isolated when you do this. You don't want a lot of the gel flowing under the tongue or to the back of the throat, and I'll tell you a little story about this. I've had kind of bad experience with this when I started using this. So you want to isolate the teeth that you're working on with some cotton rolls, and I'll have a picture of that so you can see what I mean. And then you'll administer a little thin ribbon of the gel. You'll let that sit for about 30 seconds, okay? After the 30 seconds, the marginal gingiva is anesthetized. So now you can go underneath the gum line, so into the pocket, where you probe that same sulcus. You want to go in there and administer more of the gel. By this time, the patient's marginal gingiva is already anesthetized, so they won't feel you going into the pocket and administering more gel. But that would be your second step. After the 30 seconds, you will go into the sulcus, and you're going to administer some gel around the tooth into the sulcus. Then you're going to wait 30 more seconds, and you're ready to go for 20 minutes. You can do your scaling, your redebridement for 20 minutes. And you should be good to go, okay? Like I said, the patients are their own individuals, and they may have different reaction to the gel. Some patients may get numb and they're fine. Some patients may not respond to it very well. From personal experience, what I've seen is the more involved the perio diseases, the more active the diseases, it's harder for the patient to get anesthetized with orchids. And frankly, to be honest with you, if I have a patient that is a type 3 perio, type 4 perio, active perio, I don't even mention the orchids. I just plan on using local anesthetic, okay? So, when you have patients who are periodontally involved, treatment plan your local anesthetic. But there are some cases where you have maybe a type 1, just gingivitis patient who has just a few deeper pockets with some sensitivity. I think that's a perfect case for orchids, okay? Or patients who just will not have you anesthetize them. They don't want you using the needle, and they don't want to do it. It's worth a try. You want your patient pain-free. Because if they are not pain-free, if they are sensitive and you're going in there and scaling, you are not getting in there the way you should be getting in there. If you know that your patient is uncomfortable and they're tensing up and they're jumping every time you go in to scale, then the students, it affects you, right? You don't want to hurt them. So, the patient needs to be anesthetized and pain-free before you can go in and perform your scaling and redebridement, okay? Okay, so indications for use, we touched on that already. Benefits, we kind of touched on that as well. You mentioned to me that what you didn't like about local anesthesia is the feeling, right, the numbness. Orchids, unless you get it all over the tissues, like the buccal mucosa or the throat. Okay, sure, if you can adjust it. There should be like a little lever on the side. Are you seeing me at all in there?
A little bit.
Okay. Well, it's me, Miss Jackson. It's me. Okay. Anyway, she's gonna have she'll be tickled. Okay, so you're not gonna have that numbness, that numbing feeling. Your tongue's not gonna be numb. Your lip is not going to have that full feeling with orchids. We're not using a needle. We're not penetrating the tissue. We are using a blunt tip applicator. So you don't have those side effects, those long-lasting side effects of the anesthetic. So, that's one great benefit. Quick onset is another one. It starts acting. The area becomes anesthetized in about 30 seconds, okay? And then you can work for 20 minutes. So after 20 minutes, what do we do? The patient is starting to complain that they're feeling it. They're starting to get sensitive. You just apply more. That's the beauty of it. You have it right there and you apply more, okay? The key is not to apply too much, and I'll tell you my story, what happened with me. I was probably the first hygienist in the region who ever used orchids. My employer was gracious enough to get it for me. As soon as I saw it in the magazine, I asked for it, he got it for me. And so the first time I used it, I had a patient, I was performing some deep cleaning on the patient around their back molar. So like number 15 area, number 14 area. So I just started putting the Orachix in. I really wanted to get them, you know, nice and comfortable, so I put a lot in. And suddenly the patient started hyperventilating on me. And started grabbing their throat. Guess what happened?
They swallowed it.
The throat got numb because I put so much of it in there. And what happens is when you put Orachix in there, it kind of dilutes a little bit at first, especially if there's saliva. And then it can get on the tissues, and it got to the back of his throat. He felt he was choking. It was a very unpleasant situation. I had to sit him up, and I had to rinse him out. I did not realize that you have to isolate. That is the number one thing I want you guys to remember, is isolate, isolate, isolate. Especially if you are on the terminal molars, you want to put some gauze in there. So you know where you have your retromolar pad and maxillary tuberosity behind your teeth. I not only want you to put cotton rolls around that area and hold the cotton rolls in as you're putting the Orachix on, I also want you to put some gauze in that maxillary tuberosity or retromolar pad area, so that if some of the Orachix flows back to the back of the throat, it will get absorbed by the cotton. I also have the patient, once I'm done applying it, I have them bite on a piece of gauze. So as you can see on your tray, we have some gauze for you and some cotton rolls, just to kind of practice with the cotton rolls, holding it next to the tooth. So that's important. If you guys can do that, isolate it really well, and just use a small amount of Orachix, you'll be good, okay? And also remember, and you will see this when you guys actually are working on your typodons, if you push, there's a little lever here on the applicator, on the dispenser. If you push on this, just like halfway, there's a lot of Orachix that comes out of the little, you know, blunt needle. It just flows really quickly because it's a liquid. Even if I'm not pushing on this, once you get that flow started, it goes on its own. It flows on its own. I don't even have to push on this, and it flows on its own. So we'll go over this as we go, as I have you guys follow along with the assembly, okay? We'll go over that again. Okay. The difference between local anesthetic and Orachix, I think we covered a lot of the points. You know, the side effects, the lingering effects of the local anesthetic is totally different than with Orachix. It's not injected into the tissues like a local anesthetic, blunt tip applicator. Now you guys, anytime we use anesthetic, we need to know what the maximum amount that we can use is, okay, on every patient. So this is important to remember when you're using Orachix. First of all, I don't think you need a whole lot of it because of how it flows, and you won't need that much of it. But maximum is 5 cartilages for an adult. That's maximum. And then you also have to take into consideration whether you're using local anesthetic in conjunction with Orachix, because then that's going to change, right? So, you know, I'm not going to get into local anesthetic a whole lot. Dr. K will be the one covering it for you, but I think we kind of hit on the main points for the Orachix, so you should be good to go. Precautions. So please pay attention to the precautions. Do not inject Orachix into tissues. Don't get it into eyes. So we need to have the patient's personal protective equipment ready before we start doing anything. That means patient napkins, safety glasses, right? We want to have that ready for the patient, as well as for you. You want to have your PPEs on. Do not administer excess gel. I covered that. Isolate the area. Now, post-op, after you are done using Orachix with the patient, you want to instruct them not to eat anything too hot or too cold, you know, until the feeling of anesthetic dissipates, until the numbness dissipates. Take caution when eating and drinking. Do not use cartilage warmers. I think I spoke about that enough. Now, there is no risk for pregnant women or women who are breastfeeding. A lot of patients are concerned if they're pregnant or they're breastfeeding. The studies have found, you know, I read the manual for the Orachix, the little data sheet, and it said that there are no concerns as far as that, okay? So we're okay using it on pregnant women and women who breastfeed. Okay. Now, you always want to explain the procedure to the patient. So after you take your vitals, review the health history, perform your intra and extraoral exam, you want to explain to the patient exactly what you're going to do and talk a little bit about the Orachix and how it works. Okay, what we're going to do today is use a typodont, where you're going to be applying some orchids. I want everybody to have a chance to apply it to one tooth, at least one tooth. So that means we'll have one person assemble the carrier, and then disassemble it, administer some on a typodont, and then disassemble it. So I have slides that we can follow, okay? So we're going to start with the tray setup. Everybody should have this on their tray. Does everybody have this? Yeah. Okay. Check for me to make sure it's still taping. Sorry. I think it's going to close when it's not taping anymore. It's going to take for 29 minutes. So then what's going to happen is I'll ask you if you can turn it back on. It's going to turn off after 29 minutes. So there's a button on top to turn the camera on, and then just push the red button again. Thanks for helping. Okay. Now your PPEs, we all know what those are, and you also want glasses for your patient. So I should really have 2 pairs of glasses on here. Now the topical gel and applicator, did everybody have a chance to look at the cartilage and find the bubble and make sure it's moving, make sure that it's liquid? Okay, and then as far as the applicator, bump tip applicator, we will get to that. So just kind of pull out the cartilage and then of the gel and then the applicator and just set it on the tray. Now you should also check expiration date on the cartilage of the gel, okay, to make sure it's not expired. Now what happens if the gel warms up or the liquid warms up, it becomes more gel-like, so you're not able to use it. In order to be able to use it again, just place it in the fridge. So that's a really good tip to remember when you're in offices out there, in dental offices, because everybody's going to think, okay, we have to throw it out. It's too jelly and it won't come out. You know, if you put it in the fridge, we don't have to throw it out, we can use it again. So as soon as it cools down, you can use it. It's going to become liquid again. Okay, your dispenser is going to come in a package like this. You're going to take the dispenser out and lay it on the tray. So that's the first step. There are 2 different parts of the dispenser. This part here houses the cartilage. And then this part here is screwed into the bottom half of the dispenser. See this little button on here? Can you all see it on your dispenser? This little button right there on the top of it, you can push it, and it's going to reset a spring inside. So if you're having a hard time screwing that top part into the bottom part of the dispenser, you just have to push on that tiny button to reset the spring inside, okay? Okay, so if you look, this is the inside of the lower part, and this is a close-up of the upper. First, I want you guys to assemble your bump tip applicator. So take the cardboard protector and thread it over the larger part of the applicator. So the top part of the needle. So where the larger cap is, there's a small cap and then a large cap. I want you to take the cardboard. That's a protector so you don't get stuck, because you can still get stuck with this applicator and you can penetrate your skin. So we are following protocols, bloodborne pathogen protocols, to protect you and the patient from contaminating yourselves with the blood of your patient, okay? So that's why we have that shield protector over the cap. So first thing you want to do is, whoever's doing this, just thread the cardboard over the lid, okay? And then lay it assembled on your tray. The next thing you're going to do is push the reset button, which you already done, and then you're going to take the upper part of the dispenser and insert your cartilage in there. If you look at the cartilage, there's a white portion that will go into the top part of the dispenser. Oh, you don't? I'm sorry. I'm sorry. Let me get it. I didn't know you didn't have it. Okay, sorry. Okay, here we go. Does everybody need one? Yeah, here you go. Sorry.
No, we have that.
You don't have the.
We have that. We don't
Oh.
have the thing to insert it in.
Oh, you don't have the upper part of the dispenser? Does anybody have the top portion of the dispenser? That is weird. Okay. Okay. I don't know what happened. Let me go in the clinic and see what happened. Let's turn off the camera. But I had it all together, so I don't know if they... Did you pull it out of the bag? Was the bag sealed?
Yeah, the bag was sealed, but it was by itself.
Wow, okay. I'll be right back. Sorry.